And Jared and Jacob join us from Marble City Pharmacy every second Monday of the month, and time just rolls along. We're back with you here this morning on the 11th day of January, and I was telling Jared and Jacob a little bit ago, I was thinking about this earlier in the show about, I know pharmacists give shots for shingles and flu and stuff like that, and my question was, I wonder if they can give the COVID-19 shots, and we got them to answer that this morning. Good morning, gentlemen.
Good morning. Good morning. Well, we could talk about diabetes or high blood pressure or one of those things, but let's be honest, this is the only thing everybody wants to talk about right now, and our phone lines are plenty of evidence of that.
Well, let's talk about it this morning. Early on in March, we were looking at this thing and we said, well, we don't think it's going to be a big deal. Well, it's turned out to be a bigger deal than anybody ever anticipated. And just by people ringing your phones, it's a serious deal.
Sure.
Yeah, it continues to grow, and that's what viruses do. They continue to proliferate and grow, and more people catch them. And our medical society, a lot of smart people, and God gave us a lot of abilities, and we eventually catch up to them.
Now, can we at Marble City Pharmacy, the pharmacists, give the inoculation for COVID-19?
Yes. Pharmacists can give them. We're going to be giving them very soon, which we'll talk about in just a minute. But yes, just like any other vaccine, you'll be able to get this, at least with us. I'm not privy to who else in town will have it, but we definitely do.
Yeah. Now, just a little bit different here. Have we had a lot of flu this season, or if we had it and didn't notice it, or what?
This is going to be very interesting next year when the flu season comes around, because the CDC always uses the previous year. Hey, last year, here's what we saw. I don't know what they're going to say next year, because for some weird reason, we're seeing this many. Zero.
Wow.
It's not being diagnosed at any rate. Let's put it that way. I have no idea what that means, and we could all put on our tinfoil hats and talk about that on another show for a very long time. But I don't know. We haven't seen any.
That's crazy, isn't it?
Yeah.
Because
it really is.
Every year we talk about this flu season and how many people are getting the flu and dying from the flu in our country.
Well, I don't know how to, like Jacob said, I'm not 100% sure how to explain it. I may not be 20% sure how to explain it, but we looked up our numbers just last week on the number of flu prescriptions that we dispensed. And I think since March, we've dispensed, was it 3 total or 4 total?
Wow.
Yeah.
Prescriptions for the flu.
Since last March.
That's unheard of.
Compared to maybe last
30
year.
or 40 a day.
Wow.
At this time of year.
By January, it's hundreds and hundreds and hundreds, maybe even thousands, at this point. So again, don't know how to explain it. Bizarre phenomenon.
But I got a tinfoil hat at the house I'm working on.
I got you.
Yeah.
When's the COVID-19 vaccine available?
It has already been available. It is out. The government has a hierarchy and groups who can get it. So it has already been given many doses, starting with doctors in the hospitals and things like that, and nursing home patients. So availability has already started, and it's a tiered approach we can talk about in a second. But in terms of availability, it has already started, and the next group, the reason we brought this up today specifically, officially starts a week from today. January 18th is a broadening of the availability.
All right. Who can get the vaccine?
Well, this is determined by the CDC recommendations and then the Alabama Department of Public Health. Basically, the Alabama Department of Public Health has chosen to just adopt the CDC recommendations. So we had been in the phase where we were giving it to healthcare workers and people in nursing homes. Now we're on the next phase where we're looking at first responders. There's the police and your firemen, of course, your ambulance personnel, EMAs. We have your healthcare workers, which would be us, right?
Funeral home directors like me.
And then we have, and this is the important thing that you need to hear, we have patients who are age 75 and above, okay? So if you are a first responder, if you're a healthcare worker, if you are age 75 and above, we're in the phase where you can get it right now, okay? We'll talk in just a second about how we're going to handle that at our pharmacy. But that's who it's available to right now.
What is the process of getting it done?
the reason we wanted to talk about that is it's different. Now, our normal answer on here, we'll come and we'll talk about shingles and say, just come in the store and tell us you want a shingle shot. Come in the store and tell us you want a flu shot, and we'll get it right then. This is going to be very different. There's lots of differences with this, and process is very different. We have to schedule appointments. The number of doses in a vial have to be, once you give the first one, you have to give the next one within X number of hours and finish that vial, or it's trash now, which we obviously can't have, right? We can't have that with our number of limitations. You have to sit at the store for 15 minutes after you get it, or wherever you get it. You have to sit for 15 minutes and be observed just to make sure you don't have an allergic reaction. Things like that. So it is going to be an appointment process. First time we've ever done that. Please be patient with us as we develop a whole new process we've never done in our 17 years of store existence before. So we're having to write a process today. So if you're listening to us, for our process, starting Wednesday of this week, you can call and make an appointment. We will start actually giving those injections a week from today. So January 18th, when it's officially in the state released to 75 and up in the groups Jared just mentioned, that's a week from today. That's when we're going to start vaccinating. But you can start calling on Wednesday of this week to make an appointment. We will have a spreadsheet. We will have everything scheduled out. We will have to get you scheduled. We try to schedule for 2 doses because it is a 2-dose vaccine.
Wow.
First one on whatever day you get it. Second one, at least 28 days later, ideally 28 days to the day. That's the plan, and we will plan for that, and depending on availability, if we have to adjust it, we can. So make an appointment starting Wednesday of this week. Call the pharmacy. We will get you scheduled starting Monday of next week. It will be, the number of slots we have available will start there. You do have to get scheduled for 2 shots. Let me go ahead and say this. I love each and every one of you. You're all special. But if you are under 75, I don't care how special you are. No, I'm not giving you a shot unless you have a badge of some sort that you can prove, or a healthcare worker ID tag for wherever you work. Yeah, I know you have horrible diseases and immune conditions, and I don't belittle that or lighten that. I know you want this vaccine. I want you to have this vaccine. But I cannot give it to you yet. I'm sorry, we're not making exceptions. It is not our choice. But it does make sense. We're going to follow the guidelines.
And that time will probably come.
Yeah. That time will come. The next group is going to be people who are 65 to 75, and then those people less than 65 who have certain medical conditions. The reason Jacob is saying that is because we're already getting lots of calls of people wanting us to make exceptions for them. We're getting calls and people even in person who are angry, who are mad, I mean, look, everybody's anxious right now. Yeah. I get it. But there are protocols that we're going to have to follow. So when we give it in this first round for us, we're going to have proof that you're a healthcare worker, a first responder, or that you're 75 or older. That's simple. A driver's license will get that done, right? As far as your age. And we're not going to make exceptions. My parents are not yet 75, and I got news for you. My parents are not getting it. So there's not even any exceptions for them. So please be understanding with us. We know how bad you want it. We're planning to get to you if we can get enough doses of the vaccine. Just be patient.
Yeah. We don't know, Jacob, a whole lot about this vaccine. Had there been reports of side effects, or what can some of the side effects be?
Great question, because people want to know that for lots of reasons. And we mentioned you had to sit
almost as if we gave him the questions.
Hey, I could have done that.
Yeah. We mentioned you have to sit for 15 minutes. People hear that and go, well, this must be a terrible vaccine because I've never had to do that before. It's just because it's new, right? There is no higher likelihood of you having an allergic reaction to this vaccine than any other vaccine, but people do have allergic reactions to things. 1 in X number of thousand are going to have an allergic reaction. I'm sure you've seen that on the news. Huge news. 3rd or 4th day we were giving them, some worker at a Chicago hospital had a severe allergic reaction. It happens 1 in X number of thousand. It's always going to happen. It just happened to be that particular lady in Chicago, unfortunately. So that's why you see it. But as far as, 1 in thousands upon thousands are going to have that. But in terms of normal adverse reactions, it's the same as most potent vaccines. You get it in your arm like most vaccines, and the next day, your arm hurts pretty good. And you just don't feel that good for a couple of days. You're not necessarily sick. You don't feel good. Your body is developing an immune response and working real hard behind the scenes to get something going, which is what you want, obviously. And in that process, you just don't feel very good. You feel kind of sick, and your arm stays sore for a day or two. that is 100% the most likely thing to happen to you, and it's almost inevitable that that's going to be going on with you.
75-year-olds that may be watching this morning think, well, I don't know whether I need to take that vaccine or not.
Well, that's a fair question.
Fair question.
You know, I've thought about this a lot if I were age 75. Whatever you think the risk of the vaccine is, I imagine that the risk of you having trouble with COVID is greater than your risk of having some problem with the vaccine. Do you know what I mean? And a vaccine is just like any drug, right? All of them have side effects. So the question, and listen, we're not making a decision for anybody, but here's your question. It's the same as any drug that the doctor prescribes you. Is the benefit of this drug outweigh the risk? And if you think the benefit outweighs the risk, then you ought to do it. It's as simple as that.
Difference in reactions to, say, this COVID-19 inoculation than a flu shot?
Honestly, they're not any different. The only difference,
doesn't look like it. Yeah.
The only difference is in the severity of the arm soreness. I get a flu shot every year. I tell people their arm might be sore because I'm giving them a heads up, but honestly, the flu shot doesn't really do much. This one's a little more sore in the arm. Literally, that's the difference.
Is there a cost to this for the individual?
Great question. There's not a, we should have written that on
It wasn't on this
We
list
did not
either.
write that down, did we?
Tell you what, somebody's slacking. No, there's no cost. That's a fantastic question. We will bill persons' insurances for the administration fee, but there's not going to be any cost to the patient. So even if your insurance does not cover the administration fee, there's not going to be a charge to you. So the answer is there's no cost. The government's fronting the cost.
Now, we've seen video and stuff of hospitals when they had to buy freezer type units to store it. What about here?
We do have to have a special separate freezer for it, which we do. It's beautiful. We have a freezer that all that's in it is this vaccine, and so we did have to invest in that to be able to do this, and we were happy to do so. But yeah, we're set up for it physically and temperature wise. We're definitely ready for it.
Yeah, I guess, Jared, the biggest thing is how this process is going to work. As far as, I mean, it's got to be a lot on you guys to tackle this, and you got individuals coming in that want exception to the rule, and then you got others who need this, and if you aren't careful, you can bottleneck in there with that 15-minute interval.
I'm glad you said that. You know, we're still trying to determine ourselves what's going to be the interval between appointments, you know, how we're going to do the exact schedule. We've got 2 days to figure that out since we've decided to start taking appointments on Wednesday. But I'm glad you brought that up, because what we're also thinking in the back of our minds is we still have the pharmacy to run. Mm-hmm. People are sick. It's an extremely busy time of year. So again, please be patient with us. There may be some longer than normal wait times that you're not used to experiencing with
busy
us.
signals.
Busy signals on the phone, and lots of them, right? So you're just going to have to call back, and I apologize for that, but it is what it is at this point.
Well, thank you for being with us this morning. If you would kind of recap where we are, because a lot of people watching this show tied to Marble City Pharmacy, and they may have just be joining us. Kind of tell us where we are on this and when we're going to get started with it.
All right, we can start Wednesday taking appointments by phone or walk in. You don't get a shot when you walk in, but you can make an appointment while you're in the store or call starting Wednesday of this week, 2 days from right now. And then starting 1 week from today, Monday the 18th, we will start vaccinating in our store.
And we want to remind people once again, there's no special deals for anybody who comes in the store.
Mom and Dad, sorry.
We love you, Mom and Dad. Healthcare workers, first responders, 75 and over, again, with proof, no exceptions.
All right. Thank you guys for coming by this
you.
morning. Very informative segment of Daybreak, which it always is, with Jacob and Jared. The COVID vaccine inoculation is going to be available real soon at Marble City Pharmacy, and patience is a word. Appreciate you guys joining us today.
Thank you.
Thanks a lot.
More Daybreak right after this.